Welcome to the Balanced Hormones Empowered Women podcast. I'm your host, Abby Vallejo, registered dietitian, certified personal trainer, and health coach. And what I do is I teach women of all ages how to align their diet, their exercise, and their lifestyle with their hormones to unlock their most vibrant health in a feminine based approach that's about working smarter, not harder. So today, my topic is going to be thyroid. And I feel like this is such a big one for women. I have talked to so many women, had so many clients with thyroid issues. It's a issue that tends to affect women more than men. And I know that there's a lot of confusion out there. I see time and time again women who exhibit symptoms of low thyroid, which we are going to talk about today. So they'll be exhibiting symptoms of, say, like low thyroid or hypothyroid, which is the most common thyroid condition. And yet they'll go to the doctor and they'll be like, yeah, can I get my thyroid checked? And the doctor will, quote unquote, check their thyroid and say that it's fine. And yet they have all the symptoms. And I want to speak to that because what's going on in allopathic medicine, which is your everyday, just conventional medicine, most of the time is when you go and you ask to get your thyroid checked, they will only run something called TSH. Now, TSH is thyroid stimulating hormone. And that alone, and I'm going to explain to you the process of how the thyroid works in here in just a minute, so hang with me, but measuring that alone is not enough to get a full picture of thyroid health. So stay with me because by the end of this episode, you're going to understand all the tests that you need to have a full thyroid panel to fully understand what's going on with your thyroid, so you'll be able to go into your doctor or find a functional practitioner, say like myself, who can run a full thyroid panel and know, okay, these are the symptoms, these are all the tests that I need, this is what I'm looking out for. And so you can know how to assess, do I truly have a thyroid issue? If it's something you suspect, and if it's something you already know you have, how can you take care of it more naturally and more functionally? And how can you manage it? So let's dive into that because I feel like this is a very much needed topic. So first of all, thyroid. I'm talking about thyroid. Do we know what the thyroid is? You've probably heard of thyroid before, but like what is the thyroid? What does it do kind of thing? Let's start with that. So the thyroid, I'm touching my neck because if you're watching this on YouTube, because the thyroid is a butterfly shaped gland that's actually in your neck. So that's why I'm going to probably keep touching my neck when I'm talking about the thyroid. So what it does is it produces thyroid hormones. And these thyroid hormones regulate different things in your body, like your energy, your temperature, your body temperature, your heart rate, your mood, your brain, your nervous system, and even reproductive health. So the thyroid is really important. It has far-reaching effects in the body. It's also often called the master gland for your metabolism. So if you're struggling with weight, I want you to remember thyroid because this sometimes can be a really key piece. If you're looking for weight loss, but you have poor thyroid function, it's going to slow down your metabolism and you're not going to be able to lose weight. So you got to support your thyroid, nourish your thyroid, bring those levels back up, and we'll talk about levels of what specifically and how you can measure them in order to be able to lose weight. And I've seen this time and time again. So let me walk you through. So how I said, when you go to a conventional doctor and you ask to get your thyroid checked, it's most often just TSH. So let me walk you through like what actually happens in kind of the chain of command for the thyroid to function optimally, because I want you to understand this is life-changing, I think, when you understand how this works if you have a thyroid issue. I had so many clients that I've seen that are on thyroid medication that have thyroid, even a diagnosis, and don't understand how their thyroid works because it seems like, oh, it's just so complicated. It's really not. Let me walk you through a really basic way for you to understand this. So let's actually start with the brain. So picture a brain. Now, what your brain does is it sends a signal to your thyroid and it tells it, hey, make thyroid hormone. I like to think of this as a poke. So picture your brain and it's giving your thyroid a little poke and it's like, hey, wake up, make thyroid hormone. And that's what's being measured when you measure TSH. That is thyroid stimulating hormone. It comes from your brain, from your pituitary in your brain, down to your thyroid. It tells your thyroid to make thyroid hormone. That's what you're measuring when you're measuring TSH. Great, you're measuring the first step of the process. But there's a whole rest of the process that has to happen for everything to function correctly. So the next step is your thyroid, this butterfly-shaped gland in your neck. If it responds appropriately, it makes inactive thyroid hormone. That's called T4. So T4 is actually called T4 because there's the thyroid, and then the 4 stands for iodine because there's 4 iodine molecules that are used to make T4. So it's just thyroid, and then there's 4 iodine molecules. So we call it T4. That is inactive. So it's not able to do its job yet. It needs to be activated before it can actually go and do anything. But the first step is it has to get made before it can get turned on and activated, right? So brain sends TSH to thyroid saying, hey, 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 poke, 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 wake up, make thyroid hormone. If the thyroid responds appropriately, it's going to make T4, which is inactive thyroid hormone. Then what's the next step? Well, it has to get activated, right? And you'd think that that would be happening also in the thyroid. No, 60 to 80% of activation actually happens in the liver. So that T4, it gets sent down to the liver, and the liver gets in the liver, it converts from inactive into active. And now active thyroid hormone is T3. And after it does that, now it's ready to go and do its job, but it has to go to the right place. It has to go to where it works, right? And so, like all hormones in the body, for a hormone to do its job, it actually has to go to each and every individual cell, land on a receptor site, kind of like a ship docking at a port. You can think of a cell like a little dock, and the hormone is like the ship. And it comes in, it has to dock at the port. And once it's docked, then it can do its job. But if it's not docking, not going to be able to do its job and exert its function, right? So it's a whole chain of command that has to be working. And you could kind of, just to keep it really simple, break it down in 4 steps, right? Which I've just outlined for you. So let's go over those again. So step 1, that was the brain making TSH and poking the thyroid to say, hey, 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 make thyroid hormone. Step 2 is the thyroid responding appropriately and making T4, which is inactive thyroid hormone, right? Then step 3 is it going to the liver and some other peripheral tissues and getting activated from T4 into T3, which is active thyroid hormone. Great, now the hormone is active, but how is it going to do its job? Now it has to go and it has to land on individual cells at the receptor sites, bind and deliver its message. That's step 4. You have to measure everything in that chain of command. So you can see how if you're only measuring TSH, did the rest of it work? We're kind of hypothesizing. It may or may not have. And sometimes, because here's the thing, it's a feedback loop that this functions on, right? So what'll happen is the brain, if the thyroid is not producing enough hormone, the brain will turn it up and it'll produce more TSH to produce more thyroid hormone. It's like turning up the signal. Versus if there's too much thyroid hormone being produced, the brain will turn it down and produce less TSH. So it's a feedback loop. So when we measure TSH alone, we're just kind of guessing that the rest of the feedback loop is working appropriately. But that's no guarantee that it is. And it's also not taking other things into account, like, for example, autoimmune, if there's an autoimmune component, which is more and more common these days. So things to know. But now you understand how that like chain of command works. So you understand why you need more tests than just TSH. So in the end, I'm going to tell you what are all the tests that are included in a full thyroid panel, so you know what to ask for and what to insist on when you go and get your thyroid tested. So first of all, let's talk about the different type of thyroid issues. So we have low thyroid function, which is hypothyroid, and we have high thyroid function, which is hyperthyroid. And then each of those can have an autoimmune component. They not necessarily, but they can. So if you have low thyroid and you have an autoimmune component, that's Hashimoto's. Now you can have low thyroid without being Hashimoto's, or you can have both. It depends on if you have autoimmune or not. And then on the flip side, you can have hyper or high thyroid function, and or you can also have autoimmune hyperthyroid, which is called Graves' disease. So you can have high thyroid function without having Graves' disease, or you can have both. Depends if you have that autoimmune component. But it's an important thing to rule out. Okay, so let's talk about hypo or low thyroid function first, because this is the most common, by far the most common. That's not saying that hyper doesn't happen and that Graves doesn't happen. I've certainly seen people with that, but most of the time in my experience, it's mostly hypothyroid function. So what are the symptoms of low thyroid function? And this low thyroid function just basically means like you're not making enough thyroid hormones. Fatigue, because you need thyroid hormones for energy, right? So it makes sense. If you don't have enough of it, you're going to have low energy. Weight gain. Remember how I said that T3, which is your active thyroid hormone, your thyroid is really important for metabolism and fat burning. And this is specifically linked to T3, your active thyroid hormone. So you need good levels of T3 to have a healthy metabolism. So if your T3 is low, your active thyroid hormone is low, you're not going to have a good metabolism. You're probably going to have trouble gaining or losing weight. You're probably going to gain weight and have trouble losing it and keeping it off. Cold intolerance. So for those of you who are always cold, even when it's warm, does that sound familiar? Are you cold all the time? I'm laughing because it's so common, right? Cold all the time. Cold intolerance could be related to hypothyroid. Dry skin and hair. So skin that's dry and flaky, hair that's like brittle, really dry and brittle hair is a common thing. You can kind of tell by looking at it. It just kind of has a certain look. It's usually very thin, very brittle, kind of wispy looking hair. And then another really dead giveaway is the outer third of the eyebrow. Like on the outer side of that arch, if they don't have this bit right here, so if you're looking on YouTube, if you're watching on YouTube, I'm like showing you where it is, the outer third of the eyebrow. If this part is missing, that's really characteristic for low thyroid. Constipation is another one. So often my low thyroid patients are constipated. Depression, remember, because thyroid affects your brain and your mood. So if you don't have enough thyroid hormone, it can actually contribute to depression. Brain fog, again, that's a common one with low thyroid. Puffiness, so like puffy face, just kind of like an overall puffiness. A lower heart rate, because of course thyroid is regulating your heart rate. And then like muscle weakness or aches are another common one with the low thyroid function. So now this is true across the board for low thyroid. And remember I said you can have normal low thyroid, or you can also have the autoimmune component. So the autoimmune component, you would probably have all of those same symptoms. But in that case, it's even worse, because what is happening in autoimmune, in any autoimmune disease, your body starts attacking itself, right? So normally your body is very wise and it recognizes its own cells as self, and that's how it knows to attack foreign invaders, like viruses or pathogens that come in, but it doesn't attack itself. However, in autoimmune, usually the immune system has been so hyperstimulated due to some other threat that it stops being able to differentiate between friend or foe, and it starts to attack its own tissue. And there is just kind of depending on where in the body you're most vulnerable, and that kind of has to do with genetics and epigenetics. So if someone is more vulnerable in the thyroid, that's probably where their body is going to start attacking itself. So that, like I mentioned, that would be called Hashimoto's. So it would be low thyroid function with an autoimmune component. Now, one thing, I was going to talk about this later, but I just want to mention this is commonly linked to food intolerances, especially gluten. So I'm going to talk about root causes of all of this at the end, but I just want to make the note right now that if you have Hashimoto's, or if you suspect that you might have low thyroid function with an autoimmune component, you do not want to be consuming gluten, because gluten is implicated in revving up those antibodies that attack the thyroid. So something for you to know. If you're Hashimoto's or you have an autoimmune thyroid condition, don't consume gluten. All right, now let's go and we'll talk about hyperthyroid. So high thyroid function, when your body's making too much thyroid hormone. What does that look like? So it's kind of the opposite of all the symptoms that you would experience for low thyroid function. So weight loss. So trouble maintaining weight, losing weight. These people are usually very thin. Rapid heart rate. So instead of being too slow, the heart's beating too fast. And then everything that goes along with that. So there's like a sense of like anxiety and nervousness. The person might be shaky or get tremors because the nervous system is so hyped up. And rather than a cold intolerance like with hypothyroid, they usually have a heat intolerance. So they can't tolerate a lot of heat. Instead of constipation, they usually have diarrhea. So you can kind of see it's like the opposite end of the spectrum. They might also have insomnia. They probably also have muscle weakness. That's kind of one that they both have in common. And then if they have the autoimmune component of hyper or high thyroid function, which is called Graves, a lot of times you'll see, and it's very characteristic, if you've ever seen someone like this, you'll know they have often like bulging eyes, kind of like that fish eye look. That can actually happen, and that's a pretty dead giveaway that they have like Graves' disease or hyperthyroid autoimmune. And they might also have a goiter, right? That the goiter that can happen in the neck when it like bulges out of the neck, out of the thyroid. That can also happen. So basically kind of like the opposite end of the spectrum for symptoms that happen with low versus high or overactive thyroid. Okay, so now I want to talk about what are the root causes. Why does this happen? So there's a few different main ones that I want to touch on, like what could be contributing to an imbalance in the thyroid. A big one can be the adrenals. So, I know in the functional medicine space, you hear a lot about like adrenal fatigue. Your adrenals are the gland that produces cortisol, which is your stress hormone. So if you've been in a state of chronic stress, and your adrenals are just pumping out cortisol, this can throw off your thyroid. So sometimes, yes, we have a genuine thyroid problem or imbalance that we need to fix. And sometimes people have a genuine diagnosis of a thyroid problem. But sometimes we just have chronic stress and someone's who adrenals are out of whack that has negatively impacted their thyroid. And if you fix the adrenals, in this case, you fix the thyroid, or the thyroid will fix itself. So anytime I'm looking at anyone with a thyroid issue or potential thyroid issue, I never discount stress in the adrenals, because a lot of times if we fix that, the thyroid alone, even with just doing that, the thyroid will start improving. So that's super important. Next is nutrient deficiencies. So like I was saying, you literally need the nutrient iodine to make thyroid hormone. You literally need that molecule. It makes up the hormone, the thyroid hormone itself. So if you don't have enough iodine and you don't have enough raw material, how is your body going to make thyroid hormone, right? And like where I live in the Midwest, it's very common to have iodine deficiencies. We were called the goiter belt for a long time because people were having issues with thyroid because they didn't have enough iodine. So it is very common, unless you're eating a lot of like seafood, seaweed, sushi, nori, that type of stuff, it's pretty likely unless you're supplementing, you're probably not getting enough iodine, especially if you live in the US and eat like a very typical standard American diet. Probably low in iodine. You also need selenium. Now, if you have an autoimmune thyroid condition, you really, really need selenium. I just want to make a little note here. So there's kind of a debate in the practitioner doctor space about if iodine is good or not good. And if you're into thyroid as a topic, you've probably heard people debate about it. I'm in the thyroid or the iodine is good camp, just simply because just to be so basic, but you can't make thyroid hormone without iodine. So why would you not need iodine? Each and every one of your cells in your body needs iodine. That's not a debatable fact. That is a fact. But here's the caveat. If you have Graves' disease, which is too much thyroid hormone, or you have autoimmune, you don't want to take high levels of iodine because that can really just make your thyroid even more out of whack. So if you have low thyroid function, you probably need iodine. But if you have an overactive thyroid or if you have Graves' disease, then you should watch out on the iodine because that can push things too far the other way. So selenium is the next nutrient that I want to talk about. Also, it's important for thyroid in general, but also what selenium does is it helps reduce those antibodies. So if you have if you have Hashimoto's or Graves, so you have, those are the antibodies, right, in autoimmune that attack the thyroid, selenium helps bring those levels of antibodies down, which is what we want. We want low levels of antibodies, not high, because high means they're active and they're attacking and they're causing damage. So selenium actually helps bring those levels down. So when I give iodine to my patients who have issues with thyroid, when it's appropriate, like low thyroid function, say, especially if they're autoimmune, I'm always adding in, so if I'm giving iodine, I'm always adding in selenium, because that will help regulate those antibodies, and that's super important. So I think that the debate about whether iodine is good or bad is very limited in its scope, because it's not taking into account, unless you get more nuanced, like just saying iodine is good or bad is too simple. It's too simplistic. Like, it's not bad. It's a necessary nutrient. However, is it appropriate for each and every person? A lot of times it is appropriate. There's some cases where it's not, or there's sometimes where it is, but you have to balance it appropriately with other balancing nutrients like selenium for it to work properly. So something to keep in mind, which is why you should work with a qualified practitioner who's literate in this. And you can work with me if you want help with your thyroid. I certainly love talking about it and educating people about this, because you need to know those nuances, right? There's so much noise out there on the internet, and it's important for you to understand. This is why I'm doing this episode, because I want you to understand why, and I want you to understand how your thyroid works so you can make better decisions for yourself. Okay. Zinc and vitamin D are two other important ones for your thyroid. So say you're low in vitamin D, that could be affecting your thyroid levels. Say you're not getting enough zinc, that could be affecting your thyroid levels too. Another big one is environmental toxins. So any of those endocrines, have you heard of endocrine disrupting chemicals? Those wreak havoc on your hormones, they wreak havoc on your sex hormones, and they wreak havoc on your thyroid and other things too, but we're focusing on thyroid today. So heavy metals, pesticides, plastics, that EPA in plastics, pesticides, heavy metals, those nasty chemicals, those are going to not be good for your thyroid at all. They're not good for any of your hormones. So we're all exposed to quite a bit of that. We have pesticides like glyphosates in our water supply. Unfortunately, it's sprayed on all of our food. Almost everything comes in plastic these days. There's heavy metals. A lot of people, maybe we have lead in our pipes. That's more common than you think, or like lead in the paint in our house, or like where I live, there's arsenic naturally in the soil, and there's arsenic in our tap water, so we have to get it filtered. So even if you don't think you're being exposed, you're being exposed, unfortunately. So this is something that can really negatively impact the thyroid, and if you're having issues with your thyroid, I would definitely look into doing a, detox liver cleanse with a qualified practitioner. Again, that can help you kind of decrease your toxic burden in your body to help your thyroid heal. All right. Gut health. That's another big one. So if you have dysbiosis, which is an imbalance where you have too much bad bacteria, too many bad pathogens in your gut versus good, healthy gut flora, that can cause problems. It can also cause malabsorption. So if you're not absorbing your nutrients, so this goes back to like your nutrients, right? If you're not absorbing those nutrients that you need, so even if you're eating the right things, but you're not absorbing them, it doesn't count, right? So you got to think about your gut health. If that's all out of whack or your digestion's out of whack, it can be further exacerbating problems with your thyroid. And then, like I said, food sensitivity. So the big one here is sometimes dairy, but the one that always comes to mind, like I said, with Hashimoto's is gluten. So gluten just really exacerbates that antibody situation in Hashimoto's, where, you have low thyroid function, and then your thyroid is, your immune system is attacking your thyroid. So know that if you have Hashimoto's, no gluten, please. Just not even a little bit, not like I have it every once in a while. Even a little bit of gluten can be enough to jack up those antibodies. So it's better just to completely eliminate gluten from your life if you have Hashimoto's. Best thing you can do. Okay, now as promised, the last thing that I want to touch on is the test to ask for, right? Because now that you've listened to this, you understand that just measuring TSH alone, that first step, your brain poking your thyroid, that alone is not enough to know if the whole rest of the process is functioning adequately. So here's a list of what you want to ask for when you go to the doctor to get a full thyroid panel. Even if you already have a diagnosis, so even if you something you suspect and you want to test for, or you want to just test for to be sure that you can just eliminate it so you don't have that as a problem, or if you already have a diagnosis that you're managing, you still want to be measuring all of these things, right? Because knowledge is power. So this is what you want to ask for. Of course, TSH, which they're going to give you anyway. That's the standard, thyroid stimulating hormone. You want to measure T4, which is another one that they'll probably measure if you have a thyroid diagnosis. So remember, T4 is your inactive thyroid hormone. Now, there's two kind of different versions here. You have free and bound. So it'll look like on a test, it would look like T4 and free T4. And with hormones, remember, they bind to exert their function. So you're measuring what's free, what's circulating in the bloodstream versus what's already bound up. So that just kind of gives you a picture of, the ratio there of what you have. So TSH, T4, free T4, T3, which is active thyroid hormone, and free T3. So it's T4, free T4, T3, free T3, reverse T3. This is something that I haven't talked about yet, but basically what can happen is, so if T3 is active thyroid hormone, the one that binds and does its job, there's something called reverse T3, which is metabolically inactive, but it can also bind and occupy those spaces so that the normal good active T3 can't get in. So you can think of them like parking spaces, right? So if there's a parking lot and there's reverse T3 and it's taken up all the spaces, when active T3 comes in because it wants to park and go in and do its job, it won't have any parking spaces left and it can't do its job. So what does that mean? Job doesn't get done. I just like to think of things really simply that way. And then you want to measure antibodies. So that's going to be TPO antibodies and TG antibodies. So if you specify thyroid antibodies, then those will get tested. So, and then the other thing, the final thing that often isn't included, but for me it's like a really no-brainer, iodine. You want to measure your iodine levels. Why would you not? I mean, you want to make sure that your iodine levels aren't too low, especially if you're suspecting low thyroid function. You're probably not making enough thyroid hormone. It could be because you don't have enough iodine. And sometimes just bringing iodine back in your diet or supplementing can be enough to correct that. Sometimes it's really that easy of a fix. So, but you won't know that unless you test your iodine levels. So let me run through that again. Full thyroid panel, TSH, T3, free T3, T4, free T4, reverse T3, TPO and TG antibodies, and iodine. So I want to say that any good functional practitioner, if you say you want a full thyroid panel, they will run all of those things. It's a standard, like normal Western allopathic doctor that will probably only run TSH. Maybe they might run T4 if you have a thyroid diagnosis. If you have a thyroid diagnosis, you're probably on either Synthroid or levothyroxine. Those are forms of synthetic T4. I want to make a quick note about this because while they help manage the thyroid condition, they don't actually fix it. And because what I taught you about the chain of command, think about this. So say you have low thyroid function. You go to the doctor, they run the test, it's low, they give you levothyroxine, which is synthetic T4. So what they're doing is they're giving you inactive thyroid hormone. But what if the problem's in the liver and it's your liver that's not converting inactive into active thyroid hormone? Or what if the problem's on a cellular level because you have too many toxins and they can't bind and do their job? Tell me, is just taking T4 going to solve that problem? No, it's not. Sometimes it helps, but often it doesn't actually fix it, and this is why. So I'm not saying don't take those things. They can help manage for sure, but know that you probably need to do more if you actually want to nourish and heal your thyroid. And that's where we have to go deeper and we have to look at, your nutrients and do you have nutrient deficiencies? Is there an autoimmune component? What about the environmental toxins? What about the chronic stress in the adrenals? How is your gut? Do you have any food sensitivities? We have to look at all of these things, but it starts with you getting a full thyroid panel. So if you go to the doctor and your doctor won't run that for you, find a functional practitioner that will. This is usually out of pocket. I can run that panel. I do. I love running that panel because it gives us so much information. So depending on where you live geographically, I could run that panel for you. It is out of pocket, but it's worth it, right? It's worth it. It means everything to have that information because then you know what to do. So I hope that this has been a helpful episode. I hope that now you understand how the thyroid works, what are the root causes, what are the different types of thyroid issues and why, and what you need to ask for when you go to the doctor to get tested. So if this has been helpful, give me a like, leave me a comment, share it with somebody you know that will also find it helpful. Thank you so much for tuning in, and until next time.